I'm Dr. Mike Milligan, and you're really going to enjoy this. I've got Dr. Gordon Wilson from Scottsdale, Arizona with me. Gordon, thank you so much for being with me.
Thanks for having me. I appreciate it.
Now, Gordon, he was the first dentist to have a Perio lathe in the world.
That's correct. I own the very first Perio lathe that was ever manufactured.
Millennium laser for Perio, and you do more Perio trays. That's Dwayne Keller's system.
Dwayne Keller's system, yep.
Than anyone.
Correct. Yes, I've probably done over 2,000 Perio trays by now.
Okay. Fabulous service for your patients. And so he now is teaching, he has a course that he's presenting about this. So we're going to delve into this and talk about it. So, okay, so you started out with tell us a little bit about the laser, and then a little bit about the Perio trays and your experience, some of the success, and then what you're doing now with the course that he will come and train you how to do all of this.
Okay. Well, basically, like I said, about 15 years ago, I started off with the LANAP procedure, back before it was ever called LANAP, when it was called laser ENAP.
Right.
And I was treating a lot of these severe cases, moderate and severe periodontitis. And what I was noticing is that sometimes I would get good results, sometimes I would get amazing results, yet sometimes I would get horrible results. And,
and you're a general dentist?
I'm a general dentist.
Okay, not a general dentist. Okay.
And right, so I was beating myself up because I thought, you know, what am I doing wrong? There must be something that I'm doing wrong, you know, because these patients have paid me $4,000 to treat their periodontal disease, and they look just as bad as the day they first came in.
Right. Well, I never do anything wrong, but what were you doing wrong?
What was I doing wrong? Well, I wound up going to. I thought I was doing something wrong with occlusion. Okay. I figured it had to be occlusion.
Right. Right.
Because it's one of the really tricky parts about LANAP. Yeah. And so I went to a course in Las Vegas, the appliance therapies group, and was thinking maybe I could find a new appliance to put in their mouth for the occlusion, for the malocclusion.
Okay.
And I see a company there. There was a booth for Perio Protect, and I thought, what is this Perio Protect?
Dwayne Keller out of St. Louis.
Dwayne Keller, and so they didn't have anybody there. And so I asked the person in the booth right next to the booth, I said, what is Perio Protect? What is that all about? And they said, I don't know, it's some mouthpiece that they put in your mouth and it treats the periodontal disease. And I thought, that's the most ridiculous thing I've ever heard.
Right.
And so
it works.
I went in there thinking that I was, you know, going to be watching a charlatan and a hooligan, and then I figured that I wasn't going to learn anything.
He's very academic, and
he's extremely smart. One of the smartest people I've ever met.
Yeah.
So I went in there, just crossed off, and what are you going to teach me? And by the end of the lecture, I was like, wow, that's really neat. You know, I went from being crossed off to being extremely interested in what he was doing.
Right.
And so I was bouncing off the walls. I went back home and I thought I'd found a cure for periodontal disease, and oh my God, this is the most amazing thing. I hadn't been this excited since I took Bob Gregg's and Del McCarthy's class for the LANAP.
For the LANAP, yeah.
So I was bouncing off the walls, thought I had something really exciting here, and I went back home and started using the Perio Protect method.
Yeah.
And I found that it was very, very slow, and it was kind of difficult for my staff to pick up because they weren't there with me.
Right.
And it's not real cut and dry. They didn't make it really simple.
But it's so simple, it's hard for the staff to believe it'll work.
You think that's what?
Once you get going. But anyway, go ahead.
Oh, you know, my staff was on board right away.
Okay.
And so we basically.
Mine took a little bit longer, but okay, go ahead.
I'm sure they were surprised when I came back and said, guess what, we're changing everything. They love it when you do that, right? You go to a seminar and you come back and we're changing the way we're going to do things. So I started playing around with different variations of trays and root planing and laser, and starting with the trays first and then the laser first and that sort of thing. And I eventually came up with a protocol for gingivitis, one for early periodontitis, one for moderate, and one for severe.
Okay, so
and
the
it's,
whole gamut. You've got the protocols down. And
right, and so you know, about 3 years ago, Dwayne called me up and he said, hey, what are you doing? And I said, what do you mean, what am I doing? He says, I was just on your website, and he said, your results are phenomenal.
Yeah.
He said, my results are good, but yours are amazing. What are you doing? And I said, well, promise me you won't get mad. He said, okay. I said, I ditched your protocol and I came up with my own. And he said, I want it.
Yeah.
And so we talked back and forth for a few months, and as it turns out, because of their patent, they can't tell people specifically what to do.
Right.
But they said that I can.
Right.
And so that's what I did.
Sure.
I got the patent pending now, and we're now going around and we want to train dental offices how to do it because it's so simple. It's really as simple as A, remove the calculus, B, prevent the calculus from coming back.
What about occlusion in there?
Sometimes there's occlusion, but only in the severe cases.
Okay.
You know, the great thing about it though is that the dentist's chair time is minimal.
Right.
Because what I've done with my course, in my practice, I've actually turned a dental assistant who traditionally is not a producer into a producer.
Right.
So
an assistant.
An assistant, a chairside assistant. So basically what I've got, my hygiene department consists of one hygienist and one dental assistant. And combined, they're producing over $4,000 a day for me.
Okay, well that's fantastic.
Which is six times what I paid them.
We would like to learn how to do this. Okay, so now to take your course, what do we get and what's the cost?
Well, what I would recommend is that you find 4 patients that you would typically refer to the periodontist. Okay. Then you're going to go ahead and email me their perio chart. Okay. If you can get me the radiographs, that'd be great as well.
Okay.
And based upon what your fees are, I will diagnose it and I will sequence out a treatment plan, and I will tell you based on your fees what you should be charging this patient for this course.
Okay.
For this case.
Right. For this case.
We get four cases together, and what I'll do is I'll actually fly my staff out to you, and we will train your staff in your office. Okay.
Wow.
The morning is a lecture. Then the afternoon is a hands-on training event.
Okay.
And we're going to show you exactly, we're going to have all the supplies that you're going to need to get started right away to start producing with the TLC method.
So there's a starter kit included with everything you need to get started right away. There's support, ongoing support.
Yep.
Okay. And so now as far as the cost.
The cost of the course is $12,995. Okay. That's for us to come and train.
Right.
And
it includes everything.
That includes the starter kit and us coming out to train you and everything. And so what'll happen, you'll get a training manual, you'll get videos and forms and everything that you need. And
the patients that you treat that first day, that you pre-diagnosed with Gordon,
are going to pay for the course.
Are going to pay for your course. So you're coming out of Washington, you've got this procedure for your practice.
Right. If you do 1 case a week, assuming that the average case is $4,000, and you're taking 2 weeks off every year, that's $200,000 of perio, which is a low overhead to your practice. And the doctor's time is extremely minimal on this. I spend very little time on the perio patients. My time is spent doing the perio charting, and I recommend that the dentist do the perio charting. Yeah, I do the perio charting myself so that I can diagnose, because that's how I can do my exam.
Okay.
All right. And then my staff just does a phenomenal job of educating the patients.
Right, okay. And you help us with marketing this?
If you want to, I have a package for marketing. I actually have an infomercial that brings in patients, and you're more than welcome to use it. We'll figure out what it's going to cost in your area and figure out what it would be for you to use our infomercial. Okay. But what I do is I get about a 10.6 to 1 return on investment. For every $1 that I spend marketing, I get $10 back. It's kind of a no-brainer.
That's great. And how often do you refer out to a periodontist now? You're a general dentist.
That's correct.
You've got your protocol. You've got it for all the different classifications of periodontal disease.
Correct.
I suppose your grafts, maybe your free gingival grafts.
We don't do any free gingival grafting. We don't do any bone. Bone grafting, because the bone will actually regenerate itself. So I have not referred a case out to a periodontist in over 15 years.
Wow.
Wow.
Okay.
Keeping the perio in office keeps my overhead down, keeps my stress down. I'm able to, walk around.
Right. You haven't referred to periodontist in 15 years.
Nope.
And you're getting phenomenal success on all different classifications of periodontitis.
Right, and everybody else can too. I can show you exactly how everybody can do it.
Okay, super. Your company is Perio101.
Perio101.
Your website is www.perio101.com. Okay, so do you have a phone number?
480-661-GUMS. 4867.
Okay, and you talked about an email address. Is that after we've signed up for your program that we get your email address and send you these cases, or do you want to give it out now?
I can give it out now. You can send your cases to dr.wilson@perio101.com.
Is there anything else you'd like to? I mean, we went over a lot of stuff there.
Yeah.
It sounds like a phenomenal program. Is there anything else you'd like to tell us before we close?
No, I think that pretty much touches on everything.
Simple. Keep your perio in-house, help those patients, probably
patients
even save a lot of teeth that the periodontist would condemn.
Absolutely. The patients, here's the great thing about treating periodontal disease, when you're able to get their periodontal disease under control, they then say, okay, now what can you do for my smile? It's not uncommon for somebody to come in and have a $4,000 perio case turn into a $20,000 cosmetic case. And that's, I love doing that sort of thing.
And so even if you're marketing for the perio, you're going to pull in a lot of cosmetic and restorative dentistry as well.
The great thing about the marketing portion of my plan is that you've got patients out there who haven't been to the dentist in probably 5 or 10 years, and they have needs beyond just perio. They may have some endo needs, they've definitely got some restorative needs, they might have some cosmetic needs, you know, they're all cosmetic oriented. And so once you get their periodontal disease under control, then they start asking for these other things, and it's just, it just all builds from there.
Wonderful. Gordon, thank you so much for being with us.
Thanks, I'm glad you had me.